What are the five most common childhood illnesses?
I would say at least school age children, it would be bronchiolitis, which is a respiratory infection that causes wheezing and coughing, gastroenteritis, which is vomiting and diarrhea, otitis media, which is which is our ear infections effectively, pharyngitis, which is a throat infection, whether it's viral or bacterial, like strep throat, and let's see, probably pink eye, conjunctivitis. I would say in school-age children, those are the most common.
And with these common illnesses, what is the best approach in treating them? Should you take your child to the doctor right away? Are there over-the-counter medicines? When is the right time to, dig deeper?
Right. Well, with a lot of the viral illnesses, I'm sure sometimes patients are frustrated when we say, "Oh, don't worry, it'll go away on its own," and it is really hard to hear sometimes, but it's true. A lot of viruses will resolve on their own. I think you should be concerned when, after 3 or 4 days, either A, your child is not getting better, or B, at any point your child is worsening. You should bring them in to see their pediatrician. If there's a fever or other signs that are just not getting better, you should always have them seen by their pediatrician. I would also say that there's no need to go to an urgent care right away on the first sign of at the first sight of a symptom of illness. You should usually just wait to see your pediatrician in the morning, and they can address it or guide you or even reassure you that the illness will get better on its own, or perhaps your child might need antibiotics.
Constipation is a common problem in children, even infants. How can parents treat this problem and help prevent it from happening repeatedly?
Right. Constipation is actually a very complicated illness. And the short answer to that is a lot of the times it is truly behavioral. And aside from having a good regular diet, it's very important as parents that we monitor our children's bowel habits. We encourage them to try to go every day. A lot of kids don't, or a lot of children or even parents don't know that it's normal to go every single day. And we have to check up on our children and ask them, have you gone or have you tried to go? Because a lot of times they spend their day at school and they don't have a chance to go for various reasons. And by the time they come home, the urge is gone. And before you know it, they've skipped 2, 3, or even 4 days of having a bowel movement. So it is important to speak to our children, have open communication, encourage them to frequently go to the bathroom and try and monitor their habits.
In terms of habits, does water play an important role in avoiding constipation? What are some of the tips that parents can use to make sure that their child, doesn't have problems with constipation or to avoid constipation?
Right, absolutely. Hydrating is absolutely very important, and it oftentimes it's very hard to hydrate again in school-age children because they're in class all day. So you really want to encourage water drinking. You want to encourage, of course, vegetables are very important, but fruits are also important as well, as they have natural sugars, which help with moving your bowels. So I would say sugars, vegetables, increasing your water intake, and just making sure that every day you try to take care of yourself and use the bathroom.
What about a sedentary lifestyle? Does that contribute to constipation? Is activity helpful to avoid constipation?
Of course, activity is important for many reasons, of course. But yes, moving your bowels, if you are exercising and very active, you do have a much healthier bowel motility. And also, I should add that probiotics have proven to be very helpful in preventing constipation and even helping with gut motility.
When children get sick, they're often prescribed antibiotics. What are the pros and cons of taking antibiotics?
Well, when you have a bacterial infection, antibiotics are absolutely indicated. The only way to get rid of a bacteria is to treat it with antibiotics. So that is obviously one of the biggest pros. Yes, treating frequently with antibiotics can eventually cause resistance, which means that you could develop bacterial infections that are resistant to the first line of antibiotics that we would typically use. So we absolutely do not want to overuse antibiotics for that reason. And also, overuse in antibiotics is harmful to our gut because as we've learned, it kills the good bacteria that we have in the gut, which is the reason why we encourage probiotics to restore it. So Overuse of antibiotics, of course, is not ideal. It can increase resistance to bacterial infections, and it can disrupt gut health. But it is actually very important in order to prevent a serious infection from spreading throughout the body.